Hi there, I'm Hayley Hamilton. I'm the manager of the Laboratory Medicine program, and I'm here today to show you our new lab. So nursing staff and porters will come to the lab in this main entrance here and drop off their specimens at this specimen drop-off area. After that, the medical laboratory assistants will be housed in this area. This is our specimen receiving area, and they will come and grab your specimen to receive into our computer system. Another job that the medical laboratory assistants do is they package up blood samples and other samples for microbiology to go out for testing, because we do not do all of the testing in-house. They will receive your sample and they will spin it in a centrifuge. But what this centrifuge does is it spins your blood at a high force to separate blood from plasma. The plasma will be tested on our chemistry analyzers and a few of our other analyzers within the lab. This is our chemistry area. Here we will be testing blood gas, urine, and body fluids. This is our blood gas analyzer that will test ABGs and venous blood gases. As well, our very large chemistry analyzers will be housed here. This is a picture of our chemistry analyzer. It will test blood, body fluids, glucose, liver function tests, troponin, TSH. It is the main workhorse of the chemistry department. Now on this bench here, we will have our IRICell, our velocity and IQ. This is our automated urinalysis analyzer. It will test your urine and take pictures where the technologist will review the cells on the screen. This is our hematology department. Our main hematology analyzers will be housed here to do the blood counts on your specimen. Over here will be our two coagulation analyzers that will test INR, PTT, D-dimer, and fibrinogen. When your CBC is abnormal, we will make a manual smear and look at it under the microscope. In this area over here, we will have 3 microscopes set up for the technologist to review your smear. Under these smears, you can detect leukemia, malaria, sickle cell, anemia, and many other blood cell abnormalities. This area here is our transfusion medicine department. This is where we do blood typing and screening to ensure that a patient going for surgery, mothers, or any other patient that may require a blood transfusion with blood products, that they receive compatible blood. This main analyzer does some of our testing for us, your blood type and screen. If you do have a positive antibody screen, it can sometimes be very difficult to find compatible blood. So a technologist may spend up to 8 hours determining what antibody you have in your blood. If you wanted to come and pick up a blood product, platelet, plasma, or red cell, you come to this area to receive the product. This is our histology department. In histology and pathology, specimens come from the OR and other areas throughout the hospital where we can look at those tissue samples, make them into a small glass slide for a pathologist to review and detect disease. So here is where you will drop off your tissue samples for our medical laboratory assistant to receive them into Meditech. They will also accession these samples and generate cassettes. In this room is our state-of-the-art grossing room. We have 2 brand new grossing stations for our pathology assistants to look at large tissue samples, dissect them, and cut them into small pieces to ensure that we can put them on a glass slide. Once those tissues are put into cassettes, they need to go for processing. So this is our processing room where the tissues and the cassettes will go through a cycle of xylene and alcohol to ensure that they can be embedded into wax. And this area here is where we process those tissues to create a microscope slide. What we will do is we will embed those tissues in wax over in this corner. This is a picture of what an embedding station looks like. So we will take those tissues in the cassette and put them in wax and let them dry. Once that is done, they will go to our microtomy station where we have 3 of these microtomes. What they will do is you will put the cassette into this area and cut them with a very fine blade to be a very thin slice of tissue. After that, they will need to be stained. So there's several different types of staining techniques within histology. This is our main stainer. It's called an H&E stainer. All tissue sections will receive an H&E stain. The pathologist will review and decide what other testing they would like done, including special stains or biomarkers. So over here we have an instrument called immunohistochemistry. What this analyzer will do is it will look for specific cell markers within those tissue slides and identify if there's cancer markers within the cells. After that time, once the cases come through to the pathologist, they will review them under the microscope. So this is our main pathology and administrative hallway where all of the pathologists will work and review the tissues under the microscope to provide you a diagnosis, including cancer staging, looking at margins. So that's it for the tour of the lab. Thank you very much for joining us. I'm really excited to be sharing this with you. We will be moving in the core lab on May 25th, and the histology and pathology will be fully operational on May 29th. Thanks very much.